And as a part of the motivational interviewing content, you'll commonly hear the trans-theoretical stages of change idea be brought to light as well. They're not the same thing, but they also oftentimes are partnered in how they're shared. And so one of the things that I started to look at is, we have folks that we know, quote unquote, what would be best for them. We're treating someone that has a substance use issue or whatever it might be. And we're like, we know what's best for them, but just telling someone what's best for them doesn't necessarily, or often doesn't, directly translate into immediate behavioral change. So if we go to the next slide, you'll see how the first book I ever read on this was Changing for Good. And you see the citation down at the bottom. It's this idea that we have most of what we do is around action-based interventions. It's about, this is what you should be doing. This is the behavioral change you should take. But only 20% of the change population is ready for action. And I think this also, what's interesting, let me take a step back and I'll explain to you what I mean, is we would have folks come in for substance use issues and say, all right, they're like, I've got a problem. I need to stop using, blah, 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 blah. And then sometimes in a more traditional sense, we would say, well, then you need to go do 90 meetings in 90 days, 90 meetings being AA or NA. You need to do 90 meetings in 90 days. So someone would come in saying they have a challenge, and we would give them this huge action step. And when we would give them this huge action step, we would commonly be mismatched with where they were in their change process. And because of this mismatch, these people would either become confrontational or completely disengaged from treatment. So you'd be like, I know, Jim, but I'm a teacher, I'm a principal, I'm a superintendent, whatever it might be, or a community partner. Well, how does this relate to schools? Because too often, I think we're in such a hurry for the action steps of things that we create mismatches between the people who will be responsible for implementing the change, and we don't get change implemented at the level that we really believe that it should be implemented. So what we start to look at is, how can we be better students of change? And by understanding the change process and learning how to listen and look for change status in individuals, then we can understand and approach change in a much more sustainable and thoughtful way. So in the next slide, I'll introduce you to these ideas about, here are the stages of change. Now, let me say this. I don't want you to think that this is the only theoretical construct or framework that you can use for understanding change. There's tons of them, and they're awesome, and they're written by brilliant people, and they've been tested through time. This is just the one that works the best for me, and this is the one that I've done a lot of training with administrators and schools and superintendents and people to try to get. This is a good one that fits my head. So these are the stages that we look at. So the first stage of change is called pre-contemplation. And this is what problem? I don't believe I have a problem. Okay, so if I'll put each one of these in an example of, if I'm asking to implement a behavior support system, if I go in and where our job is to look at, how do we implement a behavior support system such as PBIS, school-wide PBIS, and pre-contemplation might sound like this. Nothing you can do with kids these days. The problem with kids these days, nice little lead phrase, the problem with kids these days is they don't have any respect. They don't have any discipline. The problem with kids these days is their parents don't, teach them this or teach them that. So in pre-contemplation, I don't believe I have any responsibility to the problem or ownership of the problem. So it's like, what problem? So the problem's removed from me. Okay, that's an example. The next stage, and I will say, I see that I'll be happy to send out my PowerPoint to hand and everybody so they can share it, or it's actually on there. But contemplation. So what's contemplation? Maybe we need to change something. So what does that sound like? If I go to a school and we're working on PBIS implementation and I hear what contemplation talk might be is, you know what? Kids are different these days. The stuff I used to use with kids that used to be effective behaviorally, or the look or the scowl or the threat or whatever that I might have used before, now just doesn't seem to be as effective as it once was. So now what you're hearing is you're hearing the person start to consider that there's more to be done. So you're starting to hear, what I'm doing now doesn't seem to be working like it did before. So you're hearing that. In preparation, what that sounds like is, man, I'll tell you what, we got to find something different to do with these kids. Okay, we got to find something better to do with our discipline system. So one of the mistakes people make, I find in this in a technical assistance framework, is when they hear someone say something like, we got to figure out something to do. The mistake people make is they go too quickly into action. Oh, you're going to go this training, go this academy, learn this. We're going to implement this. It's all going to be done by, well, today's the 16th. We'll have it done by September 1st. Mistake. What happens is you have people in that preparation stage. What we need to do is kind of force people to hang out in preparation for a little longer, because the more time we spend in preparation, the more effective our action steps will be. So I want people to say, let's look at all the different options. I don't want to come in and prescribe PBIS to people. I want to say, what have you been using? What are neighboring districts using? What are the needs of your students? We want to spend some time really in that preparation stage, because we want to have tough conversations in that preparation stage. We want to talk about things like for example, big thing we're into with PBIS all the time is, why should we reward kids for doing what they should do anyways? And we have to take time and have those conversations and dig in. And then that makes our action plan be more informed and more likely to be effective. So what does action sound like? Action is, well, let's get to work on this. You know what I mean? What's step one? What's step two? What's step three? Maintenance is, okay, how do we keep it going? Right? How do we keep this thing going? You know, I heard a great quote the other day, and I have written on my board, Chris Williamson, and it's, people are way more enthusiastic and talented than they are consistent. Let me say it one more time. People are way more enthusiastic and talented than they are consistent. And man, that one stings on me a lot, because, you know, there's things that I get enthusiastic about and I can do, but it's consistency that's the challenge. So in stages of change, it's that maintenance piece. It's what happens after we get that big rush, after we get things going. How do we keep things going? And that's where the systemic change comes in, and the building better systems comes in, right? And then relapse is the stage of change where we kind of lose our way, right? And it's that, you know, gosh, we did that thing, we did PBIS and it seemed to work, but, you know, we just kind of slid back, our team hasn't met, and those kinds of things. And what I'll do here in just a second is I'll kind of talk with you about what those change behaviors are. So we'll go to the next slide. So commonly where we get the resistance from, and what happens is, as you have a better understanding of the stages of change, resistance doesn't feel as personal as much as it feels informative. So if I'm getting resistance, I do this because I call rolling with resistance. I'll talk with my hands, so you just, it's what it is. But what happens is, when we start to hear resistance and see resistance, that gives us a sense of there's a mismatch between where we are in the change process and where that individual or group is in the change process. So we need to take time to reassess and say, gosh, I'm doing action-based work with the person who is still in pre-contemplation. And we'll talk about what some of those change behaviors might be, and look at how do we take our time in doing this. And we've actually worked in some of ours. We have PBIS training academies, and we have schools that are interested in participating in these academies, that we will actually have them pump the brake. Like, listen, are you really ready? And we will have them go through a process of readiness to make sure that going to the academy is the best fit for where their school is in the change process. And oftentimes they're not quite ready, and then we get them involved in our readiness work, which is about really getting people ready to maximize. Because what happens is, those 3 days of training, it's a lot of time, it's a lot of effort, and we don't want to waste our time or their time at the wrong time with these action step interventions. So that's one of the reasons why we really got to pay attention. We really got to be listening for this, the ideas of resistance. So on the next slide, you'll see what are some of the things that facilitate resistance. The first one is just the people that are responsible for facilitating the change, just not having good change knowledge, whether it be the model that I'm using or whether it be other models, like really not seeing how true change, systemic change takes place. And that goes into this idea of a poor assessment of readiness. So what's that poor assessment of readiness? Not looking at the culture of my building. Is the culture of the building strong? What has been the building's previous successes for change? Do we have infighting among our staff? And we can talk academic and be all up in the air about this stuff, or we can go into real schools with real people and realize that this stuff isn't simple, that there are people that don't like each other. There are people that there becomes groups of teachers where the first grade team doesn't like the second grade team, or the English department doesn't like the science department, and all that kind of stuff. So we have to work on cultural issues first, because we won't have the energy or the efficiency to implement change. Timing's another one we start looking at. right now is a terrible time to introduce a bunch of new stuff because people are so stressed, just worried about in-person, not in-person, masks, no masks, viruses, all this kind of stuff, where now's not the time because we do not have the extra energy. Another thing that I always encourage people to think about is like leadership changes, staffing changes. Those might not be good times. Now, they could be good times and they could not be good times. It just depends on the nature of that shift. And resources. Who's around, that can support that? Do you have the money? Do you have the time? Do you have the people? Oftentimes, right now, there's a ton of money being flooded into education, but we have a lot of people wanting to buy stuff and do stuff. But the challenge is do we have the technical assistance to implement the stuff as effectively as possible? Now, I do think if you have money and you want to invest in infrastructure, by all means. But I think being thoughtful about that change process. And also the last one that I find is a big one is product before process, that it creates a lot of resistance. This is where schools kind of get what we call initiative fatigue, where it's where they just get tired of districts checking the box. We're going to do PBIS. We're going to be a trauma-informed school. We're going to be trauma-informed practice. We're doing this. We're doing that. And people become desensitized to meaningful change. And they just view it as, and the way they can tell is when people go immediately to the action steps and rush through the action steps in order to check the boxes, as opposed to really taking the time for meaningful change. So those are the things that we see that commonly facilitate this idea of resistance. So if we go to the next slide, you can see now, how do we start talking about assessing readiness? And on the next slide, what you'll see is here's some of the things that you might use to assess readiness. The first one being qualitative data. If you go back to your statistics course, probably you remember, like qualitative data are the things like narratives, stories, information, themes. So one of the things I'm always looking for from the lens of a behavior support system is trying to hear the conversations in the building. Are the conversations in the building about things like, what the kids need these days versus what's wrong with kids these days? Are people saying things like, I need a break from these kids, or I don't understand kids these days? Does it seem adversarial with kids? Are people observations? When we look at arrival and dismissal and things like that in a school, do we see the tone and the interactions as a very supportive manner, or are we seeing something that is more confrontational? So, then we might get a sense of, gosh, we've got some contemplation work to do. Quantitative data, one of the things we can see with that is really analyzing things like our use of what I call antisocial discipline strategies, looking at the use of things like timeout, detention, suspension, expulsion, any kind of out of instruction time. Are we overusing those kind of strategies that's removing kids from the learning environment, programming, and social experience? So we can also use data to kind of help get in front of people, because data oftentimes, I'll talk about this in just a minute too, data does a good job of getting people thinking in a non-confrontational way. And then also you can use survey data to kind of get a sense of where people are in the change process. And the next slide I'll show you, this is real simple ways that you can see, like, this is super basic. I've done this in an open public kind of way, and I've done this in a private, like anonymous kind of way, where you give an idea, initiative, or something that folks are working on, and then you get a sense of, is a person not ready? Are they unsure? Are they ready? And are they in an action stage? And what you can see is, depending on where this person is, if they're not ready, and you immediately, I'm pointing my screen like you can see it, if they're not ready and you immediately go into this trying phase, what they're going to do is they're going to drag their feet. They're going to drag their feet because you're mismatched with them in their stage of change. And then the next slide, you'll see what we have is the rulers of change. So this just takes that last slide and makes it just a little bit more complex or a little bit deeper. When we look at, let's talk about things like, I'm just using PBIS because that's what we do a lot of. When we look at things like, how important is this change? Like, how confident, that's a big one. People don't think enough about that. How confident are you that someone can think something, and I'll mention this in just a second, someone can think something's really important, but not feel confident that they can do it. I mean, that's a big deal. That's a big deal. And then also desire for the change. So we can even use an even more kind of segmented kind of approach in this way as well. And on the next slide, you'll see this idea of how this is mapped out when you see the thing of a confidence versus motivation. One thing I will tell you that you need to be very thoughtful of, and this is, I'm trying to go on a tangent about kids too, but people in general, is just by incentivizing a behavioral change, if you always have to, I would call it skill versus will. Always assume someone doesn't know how before you assume they don't want to. Because if you assume they don't want to, you are looking at will. And the only way to affect will is by motivation through reward or punishment. So if you view everything from a will standpoint, what you're going to do is try to make that change look really valuable or make the lack of change look very dangerous. But if people don't know how to make the change and you assume that, what you're going to do. So for example, if I say PBIS is so important, it's so wonderful, it's so great. If you're not doing this for kids, you're failing kids in your building. And I create this high incentive, but then down here is their skill level, like they don't even know where to start and they don't know how to approach it. The gap between skill and will is where resentment, contempt, all these kind of things can come from. So now I don't like the person who's telling me it's so important. Now I don't like who's trying to get me to implement it. Now I think PBIS is dumb. Why? Because of the separation between what I knew was so important, but I couldn't do it. So we got to be very, very careful about the assumption of always using will as opposed to assessing for skill. And I talk about a lot of that when I do trainings on kids and behavior support plans and school-wide positive behavior support, and how important it is that we only start on the skill side. So on the next slide, you'll see what are some of your elements. And some of this is repetition from the earlier slide, but your level of understanding of change, the staff's understanding and benefits and challenge about the change, right? Are we looking at how this aligns with our current vision? And the last one is probably one of the most important, is a baseline for your school's capacity for change. What changes has your school made in the past, and how can we help to sustain those levels of change? So in the next one, what you'll see is what is your goal as a person who's helping to facilitate change? Okay, in pre-contemplation, if you hear people that don't even see a sense of ownership or responsibility for the problem that you're asking them to address, your job is to get people thinking. The ability to initiate the idea of change. I want to get people thinking about change, get people considering the idea of change. And then in contemplation, I want to get people talking. In that, I want to get my leadership teams, my teachers, my staff responding to the idea of change. If I want to get people thinking, I might use things like data. I might use things like just information from the district. And then I might use that information to draw people into a conversation, which is contemplation. Get my leadership teams, my staff, just kind of putting it out there. I'm not prescribing what to do about it. I'm just getting us thinking about it. And then next, in preparation, we're going to get people planning. We're going to start talking about how might someone address these things we've been thinking about and talking about? How might we address these things, consider these things? Then remember what I said, stay in planning longer than you think. Stay just right a little long, because what happens is if we move too quick into action, I tell leaders this all the time, you move your chips to the middle of the table when you move from preparation to action. So be very careful about what you're willing to wager when you move from preparation to action. Make sure you feel very confident about the hand you have when you move from preparation to action. Action, though, is huge. Get people doing it. This is where we have the most information, the most research that tells us how to make things happen, from like the tiered fidelity inventory for PBIS. We know that you follow this thing, then you can expect the outcomes that you can expect. And fidelity often leads to outcomes. I mean, you can have fidelity for something that doesn't work. So that's why you got to look for things that have fidelity and outcome research behind them. And then there's the maintenance stage. We got to keep people going. We got to cue people. We got to recognize when people are doing it. We got to sustain that improved change. That's where we're trying to keep the train moving. But keeping the train moving is a different thing. It's almost like falling in love versus staying in love. Like falling in love is actually a little bit easier than staying in love. So we got to figure out what are those sustainable things that help us keep moving forward. And then relapse. What do we do to help people remember? Reflecting, reminding about what has worked in the past. Revisiting, kicking back into the thinking and talking phase. So we go right from that relapse to the thinking, talking phase, and then from there. So my last two slides. The next slide, you look at what would be my suggestions for people if I think about it from a PBIS standpoint. The things I might throw in there would be, first is get a coach if you can. One of the things we've found with PBIS implementation specifically, and EC implementation specifically, and trauma-informed work specifically, is if you have someone to help people, you go to this training, you get pumped up about it, and then the first problem people come in contact with, if you don't help people through those first few problems, they're going to quit on it. So you got to get a coach early. So getting a coach early is really important. Someone who has that experience, someone who can say, oh, no, this is normal. It's normal to struggle with meeting agendas. It's normal to have to revise your action plan. Kind of keeps that train moving, which is really, really important. And understanding that it's a process, not an event, is huge. Is understanding that, listen, it's not, I can't, we run into this all the time. Like people are like, yes, September 1st, full implementation. 3 to 5 years for implementation for a lot of these initiatives, PBI specifically. And like I said earlier, data gets people thinking and teams get people talking. So you got to have your data and you got to have your team. Too often people get way out ahead of themselves. And also we do what's called an MTSS analysis. And what's that? That's where we have people kind of look at what they already have in place and get rid of some stuff. You know, if you're going to bring something in, you got to get rid of some stuff. And also fancy is hard. Simplicity, scaling and general, to be able to scale things and make things more generalizable, scale on them, I'm gonna mess up the word, is really looking at simplicity and efficiency. And on the next slide, what you'll see is some of the other things we talk a lot about is focus on teaching systems first. When we're looking at behavior support systems, focus on teaching routines, protocols, and consistency to your staff and your students. Start there. Start in common areas. When you're looking at behavior support systems, when you're looking at this, start in areas that everybody shares. Starting in the classrooms is hard because those are everybody's little kingdoms, so you got to be very careful. And again, I'm talking about PBIS and specifically. Avoid starting with acknowledgement systems early. I think that's it's low-hanging fruit for people, but it's a wrong place to start because we're starting reinforcement before we start instruction, and it's also a big point of controversy for people, which makes follow through and buy-in a challenge. And MTSS, we find a lot of people shortchange tier 2. They skip tier 2, go immediately to tier 3 for kids with much more intensive interventions. So be careful about really take your time and look at tier 2, research tier 2, get that coaching about tier 2, and then steal and adapt for tier 3. You know, when you have those intensive interventions, there's lots of research, lots of information. You know, we prevent, teach, reinforce from Glenn Dunlap, Don Kincaid, and a lot of great folks with the PBIS.org approach. We've used a lot of their stuff, lots of good content on tier 2 and tier 3. So really using that to go build that multi-tiered system. So, whew, that's the stuff. That was super fast. I don't know if we have any questions. I didn't see any specific questions come in, but I hope that was useful. It went really fast, and I need to take a couple deep breaths before anything else happens. So thanks, gang.
Thank you so much, Jim. Yeah, I unfortunately don't think we have time for questions, but if you do have any questions, don't hesitate to email Jim directly, or you can email us at csoc.relap@sri.com, and we can directly email Jim those questions as well. So what's next? We know that was a whirlwind. So we are, you'll have a 30-minute break now. And again, we encourage you to do the mindful meditation moments. We have created a 15-minute pre-recorded guided meditation session to align with these 30-minute breaks. So you can follow the link that Carrie is putting in the chat right now to access these mindfulness resources. So following a 30-minute break, we will have the opportunity, as I mentioned, to choose again between one of 3 more interactive presentations. In each of these, session leaders will present a resource to support educators and students facing trauma and explore ways in which you can implement these in real-world experiences. So the first option, as you've seen before, is to dive into a CSOC created resource on addressing trauma in the classroom and the Handle with Care program. You'll look at a menu of evidence-based programs and some tip sheets on spotting and addressing trauma symptoms with students. The second option is to get experience with the online SHAPE program, which is a web-based tool to assess trauma-informed approaches developed by our colleagues, the National Center for School and Mental Health. If you haven't yet had the opportunity to experience the comprehensiveness and power of these evaluation tools, I recommend taking a deeper dive. And then the third option is discussing how to form effective community partnerships to advance comprehensive trauma-informed care in your schools and communities. I know this is a tough choice. These will all be incredibly helpful sessions. So we'll start right after the break at 1:30 Eastern. And you can access these by going to the Trauma Summit website, which I will put in the chat right now. Also, as we mentioned, all these presentations will be recorded, so we will post them online to the website after the event. Following these concurrent presentations, we will have our keynote presentation this afternoon at 2:45 Eastern from Michael Meat, and he will discuss the opioid epidemic in Appalachia. Where are we and where are we heading? And he will share evidence-based and current data practices. And as always, if you need help accessing any presentation or in general, please email csoc.relappalachia@sri.com, which I will put in the chat. And to directly access the mindfulness sessions, here is another link. So we will see you all hopefully at 1:30 in one of our presentations. And I will stay on for a few extra minutes if you have any further questions.
Appreciate everything, Hannah.
Thank you.
If you guys need anything, let me know.
Will do. Thank you so much for everything.